Hi, everyone. This is the third time I get to Doctors 2.0 and you. Thank you very much, Denise, for the introduction. I'm going to be presenting today new ways that digital is allowing us to collaborate between hospitals and pharma. Okay, I'll be covering why we do that. What is the strategy from our hospital? We are a children's hospital, the largest children's hospital in Spain and one of the top 5 in Europe. 2 case studies that we're doing with Pharma, one with Novartis and the other with Sanofi, with our colleague Xavi Olva here. And then some final thoughts for you. Okay, so let's start. Traditionally, the way to collaborate between hospitals and pharma has been this, okay? You know, pharma companies, I'm going to be very provocative here. They say that the patient is at the center. The reality is that physicians are at the center for pharma companies, okay? You might scream at me or whatever, but that's the reality. You keep saying something different, but that's the reality. And not all of them, but a subset of them, what they call the key opinion leaders, or now the digital opinion leaders, okay? The problem has been that payers, you know, they have budget constraints, and now they have decided that the decision-making for a drug consumption is not in the hands of physicians anymore, but you have to talk to the management of the hospitals or to the management of the governments, okay? So the reaction of pharma companies has been things like that. Mainly the first one. You know, you have created new structures, which is your traditional market access departments, to try to access hospitals in a different way. So you're trying to move away from B2C, from B2C, yes, to B2B. Okay, and that is difficult. What is our approach? Our approach is that hospitals can be a great partner for pharma companies to create services that go beyond the pill. And by services, I mean hardware and software. And we think that every product is a service waiting to happen. Okay, drugs are something that are undifferentiated, and the only thing to activate patients, the only thing to engage patients, is to be able to create services that they increase the adherence to the treatments. You can do that by yourselves. You know, you can create the future alone as pharma companies, or you can co-create it with a hospital. Okay. Each of the partners in the 2 cases that I'm going to be presenting have different assets, and we can build on them. You know, here are some of them. The hospital knows very well about certain things, and the pharma knows very well about other things. You know, and the conjunction of the thing is, you know, it creates a greater value for both of us and for the patient. So how does it fit in our strategy? Simple. You know, we, as Denise was saying, we have been running for the last 4 years an initiative called the Liquid Hospital, which is an initiative with more than 20 projects that what it does is provide services and content to patients outside of the building blocks of the hospital, you know, using different technologies. This is here, and this is the more concrete solution, okay? So we do things in e-health, in social media, online communities, and collaboration. So in e-health, there are 2 things up there, which is email consultation and video consultations. We can do that, and we can leverage that to all the services in the hospital, but to do things in telerehabilitation and telemonitoring, we have to do them case by case, and for that we need help. So let me explain to you these 2 case studies that we have. One is with Novartis, the first one in telerehabilitation in respiratory, and the other one is with Sanofi, which is telemonitoring obese children as a precondition for diabetes. So let's start with the first one. The first one is called Funny Friends. It's a gamifying respiratory telerehabilitation. Okay, what is the problem? Cystic fibrosis. You know, the treatment is terribly boring. You know, we are a children's hospital, and this treatment, this therapy, is the subject of a lot of discussions at home, because in the end, it's about blowing and, you know, inspiring and expiring all the time. And children don't do that. It's boring, and we thought, why don't we try to gamify that? Why don't we make it fun for the children and try to capture data for the hospitals, so our therapists can learn from what is happening? Okay. So we decided to create a game. This is a gang of superheroes, 4 superheroes. My favorite one is Fante, the elephant. You know, he's the leader of the gang. And you have a hardware here, which is the flute. You use the flute to do the exercises. Okay, so that's what you do. You create, you call the gang, and you do different things with the flute. Okay, and then you know, there are different scenarios that the patients go through them. You know, it's like a traditional video game. The goal, again, is to increase adherence, and the results that we've done so far, you know, it shows that it increases adherence to the therapy. Now we've have won 2 prizes, one with Fundación Vodafone in Spain and the other one with the prize of Innovar. We have a patent filed already, and we are working on a clinical study. Okay, the way we do that with a pharma company is that we co-create the product together. Okay, we co-develop the product together. It's not them telling us what to do or us doing things on our own. Okay, sometimes we have meetings on our company, on the hospital. Sometimes that we have meetings in the hospital. Okay, and we try to leverage the assets that every one of the companies has. Okay. The second project is it's PreventGo. It's a hybrid digital health solution for obese children, and we're doing this with Sanofi. Here is Xavi Olba, our partner on the other side. Okay. What is the problem? You know, USA, 34% of the children are obese. You might think Spain, you know, is very nice, no obese children down there. You know, numbers show that we have 31% of children who are obese as well. You know. And the problem is that when our people, our physicians and our dietitians work on this, trying to solve it, they say, well, you know, we've tried everything and it doesn't work. Okay, so you know, let's try something different. Okay, so we decided to do what we call, you know, a hybrid health approach, which is using technologies and using people to try to engage obese children in doing more exercise. This is the team, you know, so we have people on one side. We have the head of the endocrinology department, we have a nutritionist, and we have another nutritionist which acts as a health coach. Okay, so she is the person to engage daily with the patients trying to do things. Okay, and then we have Fitbit, you know, these devices that you know already. We provide one Fitbit, sorry, for the children, for the kid, and one Fitbit for the parent. Okay, so we make them compete and we make them do things between the children and also between the kid and the family. These are the kids. As you can see, some of them are indeed obese. They are opening the Fitbits. We were a little bit afraid maybe that they will lose the Fitbits. The reality is that we have only lose 2 of them, which is very, very little. You know, they take very good care of them. And you know, what we do is we track their activity. You know, we compare them, we show data to them. You know, it's a way of engaging them in doing things. The health coach tries to create motivational challenges. So each week we make them walk from the hospital to a different European capital. Okay, and we also try to engage them in learning. You know, what are the good things about the capital? So if you go into Paris, you know, what are the good things in Paris? What can you see in Paris? You know, etc. So that's how we engage them. The third thing is we try to engage parents and kids to try to learn together, because we know that children who are obese, parents are a reason for being obese, not because they are obese, but because the habits they have, you know, make the children a little bit become obese. Okay, so we teach them, you know, what should be the right look of a fridge. You know, what are the things, you know, you can see on the left there is all, you know, dusty things, and then on the right, you know, more healthy things. Okay. And then the result of that is a lot of data. You know, with this data, you know, we can do things. We are tracking, you know, how much they walk, how much they go up, how much they sleep, okay? So with this data, we can do things and we can learn what is happening with these kids, okay? So to finish up, have 1 more minute, some final thoughts, okay? These are the final thoughts and the key messages that we've learned from these 2 practices. And number 1 is that drugs are undifferentiated products. So if you want to activate patients and engage them, we need services. Services is the things that engage patients, okay? We think a hospital can be a great partner for a pharma company, and we've got examples to prove that. It's a different way of approaching the problem. You have to approach the institution. It's an institutional project. It's not a physician project, so it's moving from B2C, from B2B, and that in the pharma mind, it's complex. You need C-level involvement. In both cases, at the CEO level at the hospital and also at the CEO level and also at the C level at the pharma, because it's very disruptive for them to do that. Also, innovation doesn't have a formula. You know, we're learning all the time. You know, we fight lots of times because, you know, we want to do something, they want to do something else. You know, that's how you learn when you're doing new things, number 4. And number 3, it's a team project, you know, so it's not about their business unit and one of physician on my side. It is about what key resources they have in their institution, no matter in what business unit, and what key resources we have in our hospital, no matter what business unit, okay? So with that, I want to end, and thank you very much.